So how many of you know me? Raise your hand. Yes, yes, good. Okay, first, before I start, we have to give a big, loud round of applause for Sebastian and the team. Please, big one. It's not easy to arrange all this in New York City. I'm telling you, the city is difficult. You know, I'm sure when you guys come here, you realize, right? How many turns and how many exits you miss, right? To come here. So that's New York. But one thing I will tell you, if you can make it in New York, you can make it anywhere, okay? So, few years ago, when I was an IMG like you guys, and there were some companies sending me some students for rotation, because that's part of, you know, now a few of the requirements. And when I asked somebody how much they're charging, I was shocked and depressed actually, because what I thought, I'm from a very poor family. And I went back 2002 and I realized if I have to do that on this price back in 2002, I can never do it. I could not have afforded it. I could not have made it. So I get together with few of my physicians and we made this company called Brooklyn USCE. We lowered the price because we just cut out the middleman. It's very affordable. And Sebastian told me to tell you guys something about the rotations. What are these rotations, why you need it, and what are these do's and don'ts of it. Okay, so I'm gonna go for it. So first of all, welcome to New York from my team. They are all here. We have a booth all the way in the end where you are getting cotton candy. So if you don't get it, please get one. All of you are here with a dream, right? All of you, right? And dream is, what is the dream? Match 2023. Yeah? So all of you, please do one thing. When you go home in your room, just put on a paper, Match 2023. Every day you wake up, do something to achieve that dream. And you will achieve it. I can guarantee you. If you do effort in this country, honestly, with your heart, you will achieve your dream. All of you will match. I'm not going to talk about red flags, blue flag, green flags. For me, there's no flag. This is a land of opportunity. Everyone can make it. Everyone can make it in the country. I have seen people failing. I have seen people with low score. I have seen people with high scores. If you put effort, you will make it, right? Now, what is the most important thing in your application? Everyone knows that. Scores. I told Dr. Fisher so many times, don't do that. But he don't listen to me. He look at the scores. Everybody looks at the score. So what is the second most important? Second most important is who is writing your LOR and what is written in your letter of recommendation. Your letter of recommendation should not be from somebody you did not work with. Don't do that. Get a letter from someone who you work with. And that letter should be based on how did you perform in that rotation. And it should be visible from that. It should be visible that Julia worked with someone and she worked hard, and the letter should show that. So that's what is required. Be very careful when you apply. There are different requirements from different programs, how many months of clinical experience you need. And it's very, very clearly written on their website, by the way. So go through that. Most of the programs require 3 months. There are very few require 6, 9. I think there are 2 programs in California, they require 12 months. So look at that. Go whenever you're applying. So 12 months is too much actually. I don't know how an IMG can do 12 months of clinical experience. They give you visa only for 6 months, right? So 3 months is 99% programs require 3 months. Now what to look for when you're doing your rotation, right? What to look for? Try to see if the doctor you're working with, doesn't matter it's a hospital or a clinic or whatever setting it is, doesn't matter. There are patients that you are getting chance to see the patients. Under supervision, you cannot see on your own. Under supervision, you can do, you're taking history, you're doing exam with the help of your doctor, and you're also participating in assessment and plan, and you're writing notes. Because once you do that, and then you go for an interview, and program directors are very smart. They will know what you know. They will ask you questions and they will figure it out. And if you can tell them that you have done that, so they take you. All the students who come to me, they match. I don't know how, but they match. So you should also learn electronic medical record. Very important, as many as you can, okay? Also, you should be able to write your note and make sure the rotation has some sort of didactics. Maybe it's once a week, fine. Some kind of tumor board, journal club, whatever is available. Without didactic rotation, there is nothing that doctor can write about your knowledge. If they are doing some sort of didactics, try to present a topic of your knowledge or whatever interesting case you have seen. Also make sure when you're doing those rotations, they have some sort of opportunity for you to write a small poster paper. We met a ACP president, so please make sure you're a member of ACP and AMA. It's free for the student and very cheap for for the graduates. So when you do that, they give you an opportunity to present these posters and papers in the journals, and that look very good on your CV. When you go for an interview, there is something special in your application which is not to the other candidate. Because once you're in an interview, score does not matter. Then what matters? What is written in your application? If you have done 2 posters, one in AMA, one in ACP, and it's very easy, I'm telling you. They need it. You guys need residency, they need residents, okay? So don't be nervous. They are also as anxious as you guys are. So try to write posters and even if they don't accept it, it's okay. Just put it in your CV. Effort which matters, right? So many researchers do this years and millions of dollars they spend on research without any results, right? But we don't say that they didn't put effort. They put effort, right? So effort is important. So write that in your CV even if it's not published, okay? Now, there are few things I want to tell you and then I will finish. There are few things when you're doing a rotation with someone, there are 5 do's and 5 don'ts, okay? First of all, when you do a rotation, be presentable. When you're coming from a different country, right? And when you're going for this exposure to a US healthcare system, you're seeing these new people, make sure you're dressed properly, professionally. If you are a male, make sure you wear a tie. For females also, professional dress, covered shoes, white coat, all these things. Because if you put that habit now, it will stay later on. And in America, I know we always say we are not a formal country. We are 100% formal country. We don't say in front of your face. So please do. Number 2, be professional. Especially when you're speaking with the patients. I have seen students come from different countries. And the way they speak with patients in that country, when they come to me, they try to speak same way with my patients. Not acceptable here. You have to respect your patient, okay? Here, you have to call them by their last name. You have to make sure you are respectable to them, so they will respect back to you, okay? That's very, very important. Proficiency. You have to be proficient when you are with a doctor, especially like me. When you do a rotation with someone who's busy, he don't want a sloth with him, okay? So you have to keep up with the speed, learn in next few days. So if you don't know something, tell them, I don't know. It's okay, we like I don't know, but we don't want mistake. And after that, oh, I didn't know about this. So ask. If you don't know, you ask, okay? Also be perceptive. Whatever things we tell you, we are telling you from experience. All these doctors standing here who are speaking, all these IMGs, Dr. Segal, Dr. Fisher, they are in this business from 40 years. They are pure gold. Whatever comes from their mouth is very valuable. Listen to us, whatever we are saying. I was talking to some students yesterday, and when I'm talking to them, they are looking here. No, don't do that. Listen to me, what I'm saying. You get this very, my time is precious, right? And you are talking to me now, so listen. It may help you, these small things, okay? Punctual. Please be punctual in this country. If your rotation start at 9 o'clock, be there at 8:45. I always tell all my students, all my best interns, all my chief residents, all my fellows are the residents who come to work 15 minutes early. Go to work 15 minutes early. Don't come 15 minutes late. That 15 minutes make a lot of difference. You will be one of the best interns, and to come 15 minutes late will be one of the worst interns. Please don't be the worst intern. Be the best. 15 minutes is not a big deal. Yeah, once in a while there's a traffic or something, it's okay. But don't make it a habit going 15 minutes late. Go to work 15 minutes early, okay? Now don'ts, okay? Don'ts. Number 1, Don't be impolite, okay? 5 eyes. So there are so many students when they work with me, they're so nice with me. They're so nice. With my staff, they're assholes. Don't do that. Don't do that. My staff is my family. They tell me everything. Be nice with everybody. You know, one of the greatest thing of this country is equality. A CEO of the hospital and a custodian sit on the same table and eat same food. Okay? So keep that in mind. Respect. Respect everybody. All right? Also, don't be impassive, means don't be lazy. I have sometimes students comes in, I will know if you're lazy. I will not say you, but I will. Sometimes I do. But try to learn. You're flying from all over the world to learn something from me. You're paying for this. So when you come here, at least those few hours you're spending with me or with any other doctor, don't be lazy. Do your work. You have to sleep, go home and sleep. Sleep at night. But when you are working, you have to be up. If there is a patient waiting outside, don't try to avoid, okay, I'm not going to take this patient. I will know that, okay? So then try to give us, me or other doctors, good reason to write in your letters. Don't give us any bad reasons. We will not write anything bad, but don't give us good things to write about you. Give us some good things which I can write in the letter so that director will read the letter and say, yes, this is the person who I want on my program. Otherwise, I will, for some of the good students, we go as far as calling program directors, emailing them, not only LORs. But for that, you guys have to show me that you are worth it, okay? So make that 1 month, 6 weeks, whatever the time you spend with us, make sure that I have reason to do that, okay? Make sure you are responsible. Don't be irresponsible. We are training you to save somebody's life. It's a very important job. If I tell you to do something for a patient, I don't expect you to go home without doing it. I don't, even if it's a small thing, because small things can, somebody can lose their life. So whatever the task is given to you, finish that. If you have to go and you cannot do it, tell us that, listen, I have to go home, I cannot finish it. Can I give sign out to somebody? Which is perfectly fine. Be responsible, okay? Also, don't be irrational. Don't. Not in the 1 month you're doing rotation, because you did not even start your residency. And don't always do rational things, When you see patients, make sure they're comfortable, be nice to them. And also, as I said, don't be nice only to the doctor, nice to the staff, nice to the other patients also. Whenever you're talking to somebody, if they ask you a question, try to answer it if you know. If you don't know, tell them, I don't know, I will check. That's it. So these are the few things, if you keep in your mind, you guys will get very good LORs, and they are important. They are a very important part of your application after the score. Okay? And the last thing, and this is from my heart. Don't be insensitive, guys. Be good human beings. Okay? There's a lot of hate in this world. Try to do one random kind of act in your life every day, and let other people also do something. Little small things. Feed a bird. Give a homeless some food. Give them, try to do good things. As a physician, our job, God gave us this gift of saving life, right? So don't say no to anyone. Try to do it, okay? So that's advice from me. I'm gonna be here for 1 more hour. Anybody want any advice, anything, I'm there. And if you guys have any questions. So I think I took more than 5 minutes, but I hope you guys like it. And our booth is at the end. We have cotton candy if you want. All right, thank you guys.
Thank you so much, Dr. Khillan.